good morning to each and everyone, especially to you, ma'am. So now I'm going to discuss to you one of the cystole, which is the diphyllobothrium latum. So when you say di means two, when you say philo means left, when you say bothrium, it refers into the sapping groups or what we call the bothria. And when you say latum, it is a term that used to describe for older humans as a tapeworm. Always remember that this parasite, the diphyllobothrium latum, has a two bothria. So for the introduction, it is also known as a broad fish tapeworm or what we call the fish tapeworm. And also the common associated disease is the diphyllobothriasis or what we call the broad fish tapeworm infection and the fish tapeworm infection. However, it is one of the 13 species that known to infect humans. And the diphyllobothriasis, it refers to the intestinal infection with adult worm. So for the better understanding of this parasite, we have the classification of this parasite or the D. latum. So it belongs into the kingdom Eukarya. When I say Eukarya, it refers into the multiple eukaryotic organism that it refers into the parasite. And it is belong into the phylum Platyhelminths, which it refers into the flatworms. And it belongs into the class cystodes or cystodia because cystodes are tapeworms. And however, it belongs into the order Shodophalidae. So when you say Shodo means false, and it is only the parasite or belongs among the cystode that belongs into the order Shodophalidae. And also other cystodes are belong into the order Cyclophalidae. And I will discuss further or later about the why it is called as a false tapeworm. And then it is belong into the family Diphyllobothriidae and genus of Diphyllobothrium. And the species which is the latum. So next, for the history, it is in 1592, Donus was first to describe and recognize of the latum or Diphyllobothrium latum. In 1602, it was confirmed by Platter, who differentiated it from a Datina species, which is the beef and pork tapeworms of human. Then in 1883, the fish was shown to contain the stages that transmit the parasite to humans. Then by feed plerocercoid, which is the plerocercoid is the infected stage to human. Then it will transmit from fish to cats, dogs, and medical students. And also, in 1917, the rule of the copypod as a first intermediate host was elucidated by Jahnke and Rosen in 1917. So next, for the epidemiology, it is prevalent in temperate zone where the population has the habit of eating a raw or improperly cooked fish. And it is the preference for eating a raw fish is and lack of sanitary toilets facilities has contribute to the transmission of the parasite. And it is present into the Baltic countries, Switzerland, Armenia, and Belgium. And Asia, it can be found in the Turkestan, Northern, and Japan. And also in Americas, it can be found in the Argentina, in some from North Americas, and also in Canada. And also it is present in the Japan. So I will discuss later why it is prevalent in Japan. So next, so for the morphology, of the latum egg is that the parameter and description, it has a size range of 58 to 76 macrometer long and 40 to 51 macrometer wide. And it has a shape of somewhat oblong, and it is embryo which is undeveloped, and it has a term coracidium. And the shell is that the smooth yellowish brown in color, and the other features, it has an operculum and terminal knob on opposite end. So as you can see in the picture, it has of the latum egg. The very unique characteristics among the cystode is that it has the operculum and the knob. So what is the purpose of the operculum? It has like a cod-like or covering-like opening of the operculated eggs in the fresh water. And then the knob is somehow siya sa formation of the embryo. And then inside of this egg has a term coracidium or the immature or undeveloped ova. So that also, so it has a somewhat oblong and also brownish in color.
So,
So when you say scolex,
one, two, three.
so for the diphyllobothrium latum of adult worm, so the scolex, di ba, it refers into the head. So it has a number of sucking grooves, which is the tubothria, and it is a shape of sucking grooves, which is the almond shape, and it has a size of 2 to 3 mm in length and 1 mm in diameter. So when you say scolex, it is what worm uses to attach itself to the intestinal tract. And then the bothria, has a weak muscle but capable of sucking action. That is what worm uses for the attachment, or siya ang nag-provide for the attachment for the intestine. And then the mature proglottids has a size of a 2 to 4 mm in length and 10 to 12 mm in width. And the location and appearance of the uterine structure has a central and rosette. So I can see in the picture later. So next. So for the terminology, we have this what we call the perocercoid, which is the larval form or the infective stage that found in the fruit flesh and also the freshwater fishes. And in the latum, it refers into the worm. And also the proglottids is the segments of the flatworm that each of them, of proglottids, is contain both male and female reproductive organs. So the scolex it has the part of the anterior end that is a long and spoon shape. It is what worm uses to attach itself to the intestinal tract. So next. So as you can see, this is the picture of the adult worm and the diphyllobothrium latum egg. And this is the parasidium, procercoid, and perocercoid. So first, we're going to discuss the adult worm. So as you can see, this is the scolex or the head of the adult worm, and this is the neck of the worm, and followed by the neck or closest to the neck is followed by the immature proglottid. And this after that, the terminal fourth and fifth of the proglottid is the mature and gravid proglottid. So each proglottid is contain both male and female reproductive organs. Then this gravid proglottid has a contained uterus and ova, because in this gravid proglottid it fills many eggs, and these proglottids will disintegrate only when the segment has completed its reproductive function, and it is the distension of the uterus and uterine pore is relaxed. Then the unembryonated ova is discharged from the proglottids. Then this proglottid or the gravid proglottid will release for about 1 million eggs per daily, or mag-release siya ng egg daily. And then the egg has the operculum, as you can see in the structure. It has the operculum, and then it has the knob, and this outside of this is the term corasidium or the undeveloped ova. And this is these are the three stages or the larvae that has a important for the life cycle to the transmission of the parasite into the human, because the first larval stage is corasidium. This corasidium will happen inside in the water. Then the second larval stage is refers into procercoid larvae, in which it is happen inside in the copepod, which is our first intermediate host, which is the copepod, or what we call the crustacean. Then our third stage larvae, or what we call the infective stage into human, is the perocercoid larvae. And then this perocercoid larvae will happen. This is what we happens into the freshwater fish, which is our second intermediate host. Next. So this is the picture of the adult worm, or this one is a picture of the mature proglottid. Then as you can see, this is the testes of the inside in the mature proglottid, and this is the uterus. It has the central rosette formation. Then it has also this is the ovary of the. Then this is the genital pore, and this is the vagina and the sperm duct and the secretory canal and the Mills gland and also the vitelline gland. So As you can see, it is very immature ang yung proglatids, and this is the mature proglatid and the brevid proglatid. Take note that inside the brevid proglatid has a uterus and ova. So next. So for the mode of transmission, it is the ingestion of undercooked fish. And for the diagnostic stage, it is an embryonated egg that is passed in the feces. Then it is the definitive host is the human, dog, cat, and other mammals. And also the intermediate host, which is the refers into the copepods and the freshwater fish, which is we have two intermediate hosts, and also we have the infective stage, which is our plerocercoid larvae, and this is we have the palatenic or the transport host, which is the carnivorous fish. And then next. For the life cycle, we have, as you can see, so for the life cycle of diphyllobothrium latum, so for the life cycle of diphyllobothrium latum, so first, it is the unembryonated egg are passed in the feces of the human host. Then this egg will develop or complete its development in a fresh water. Then after that, take note that the life cycle will continue into the crustacean. Then, however, the small ciliated coracinium larvae will hatch from the mature eggs and then swim until ingested by the crustacean. Then the second larval stages is complete its development in the crustacean with the developing procercoid larvae, which is our second larvae or stage. And however, that the infected crustacean is ingested by the small freshwater fish. Then after it's ingested by the small freshwater fish, the plerocercoid are then released from crustacean into the fish. Then the larvae will continue to develop into the flesh of the fish to develop into a plerocercoid larvae, which is the plerocercoid larvae is the infective stage to human. Once the human ingested or eating a raw or properly cooked fish, they will become infected because that fish was shown to contain the stages that known to infect human, which is the plerocercoid larvae. However, after that, the large predator fish will ingested by small freshwater fish. Then the plerocercoid will infect only the large predator fish, but they will only infect the large predator fish, but they will not continue to grow because the fish is only transport host or our palatenic host. Then after that, the human will ingest or eating a raw or improperly cooked fish. Then after that, the adult worm is that the plerocercoid is not digested. So, but instead it will remain inside, or instead it will remain in the small intestine, which is its new host to grow into adult worm or into adulthood. Then after that, the proglatids will release immature eggs. Then after that, mag-release siya ng immature eggs, then completing the cycle. So next. So for the pathogenesis and clinical manifestation, we have the symptoms, which is the nervous disturbances, digestive disorder, abdominal discomfort, weight loss, weakness, and anemia, which is the vitamin B12 deficiency anemia. So why is it cause a nervous disturbances or neurological symptoms? Because of impaired myelin sheath synthesis because of lack of vitamin B12. So when you say vitamin B12, it is important to supply nutrients in our nerve tissues throughout our body. And however, because of the impaired myelin sheath synthesis, because the vitamin B12 is important for a myelin sheath formation. So if there is no vitamin B12, there is no myelin sheath. Just try to imagine that axon has a myelin sheath. So the reason why napaspas ang conduction of the myelin sheath of the axon because with the help of the myelin sheath. So if you don't have vitamin B12, there is no myelin sheath. So there is no functional nerve. So that is why na makakause siya ng loss of sensory nerve or what we call the nervous disturbances and neurological symptoms because of impaired myelin sheath synthesis, lack of vitamin B12. Then after that, it is cause of the diphyllobothriasis. It is common associated disease of this parasite. However, diphyllobothriasis will cause, it is the intestinal infection with adult worm that will cause into digestive disorder, abdominal discomfort, weight loss, weakness. And also, why is it makakause? And also the anemia. Which is the vitamin B12 deficiency anemia. So as we all know that adult worm has the extra affinities toward vitamin B12. So it competes the host by blocking the absorption of vitamin B12. So once deficient na ato vitamin B12, it will cause into deficient, which is mag-cause na siya into megaloblastic anemia. So first, where is the main site of absorption? Diba? In the small intestine. The small intestine are main site for absorption. However, if that it asa siya gina-absorb particularly where, diba? Most likely in the ileum, and the adult worm will reside in the jejunum because so the chemical that we need so that the vitamin B12 can be absorbed is the intrinsic factor, right? So that intrinsic factor, why is it that vitamin B12 deficiency anemia is a type of a pernicious anemia? Because the pernicious anemia is the destructions of our parietal cell, and it is a lack of intrinsic factor. So the vitamin B12 cannot be absorbed or cannot be longer absorbed because our parietal cell is destroyed already. So that is why na lack of intrinsic factor, because the intrinsic factor is produced by our parietal cells, right? So kung gigid ko na siya out of parietal cell, so vitamin B12 cannot be absorbed. However, why is it that the vitamin B12 deficiency anemia is mistaken for a megaloblastic anemia? Why? When we say megaloblastic anemia, it is the large red blood cells, which is large red blood cells that cannot exist in the bone marrow to enter the bloodstream to produce oxygen. However, when we say megaloblastic anemia, it is the absence of vitamin B12 in the diet. So there is a lack of a vitamin B12 impaired DNA synthesis. So first, we're going to classify what is the main difference of the hookworm and the dilatum of anemia. However, the hookworm of cause of anemia is loss of blood. However, the dilatum is the cause of anemia of diphyllobothrium is consumes of your vitamin B12 in the intestine. So so the type of anemia is that of the hookworm is the iron deficiency anemia. Unlike sa diphyllobothrium is the type of anemia is a vitamin B12 deficiency anemia. And then the classification of anemia, unlike sa hookworm, is the microcytic, which is in the diphyllobothrium, the classification of anemia is the macrocytic hyperchromic. So pasabot that the hemoglobin and also the hematocrit, both of them will low, but the MCV of the dilatum will remain high because it is the macrocytic naman. So pasabot, our neutrophil will become hypersegmented. So kung hypersegmented neutrophil means what is our normal lobes of neutrophil? Diba? The normal lobe of our neutrophil or in our white blood cells is the 3 to 5 lobes, right? So because of the hypersegmented neutrophil, our lobe will become 5 to 7 lobes or 5 to 8 lobes because remains large. Because the megaloblastic anemia is that what is the normal red blood cells of what is the size of the immature red blood cell? Is it smaller or large? Small or large? Di ba? Large. Because, when we say megaloblastic anemia, our red blood cells will become large. So, pasabot, so it will undergo, parang sabta na to, why it is called na megaloblastic anemia or macrocytic, it refers because it will, di ba, when we say mitosis will undergo DNA replication. So, if there is no vitamin B12, there is no DNA synthesis, right? So, the mitosis cannot undergo or continue. So, pasabot that the immature red blood cells cannot undergo mitosis. Because, meaning, if they cannot undergo, meaning they will remain large. And that is macrocytic, or what we call the megaloblastic. Because our blood cells is immature. So, they cannot reduce to undergo mitosis. So, get? Next. So, for the diagnosis, it has a finding the characteristic of opportulated eggs or Asian probabilities in the stool. So, it is for the diagnosis we use to have direct fecal smear, which is usually softest, and the Cato technique, which is also useful in demonstrating the egg. So, next. So, the treatment is we have the applicable treatment, which is the praziquantel and the niclosamide. However, the praziquantel is a drug of choice, or what we call the standard treatment. And with the niclosamide, this is the alternative treatment. So we have for the praziquantel, those patients who are affected with this such parasite, is you can only take 5 to 10 milligram or kilogram single dose, and this is the drug of choice for this infection. And also, the niclosamide is the adult can 2 grams, and also the children is 50 milligram 2 kilogram. So we can only say na this treatment is effective once the scolex is found in the stool, because our specimen of choice is the stool, right? So once makita na tong scolex or head in the stool, so we can say that the patient is no longer affected, or the treatment is effective. So if the scolex is not recovered, so pasabot a repeat stool examination is done after 3 months, which is to be certain that the patient is no longer infective with this such parasite. So next, so for the prevention and control, we have this all freshwater fishes should be thoroughly cooked and also freezing for 24 to 28 hours at temperature of 18 degrees Celsius, and kill all presorcoids, which is our infective stage. And also, we should have a proper disposal of sewage and marketing of fish. So, next. So, for the nice to know facts, the diphyllobothriasis is the disease caused by the diphyllobothrium latum that was once prevalent in Japan, as sushi and sashimi are very common foods that consist of mostly raw fish. Diba? Why it is very prevalent in Japan? Because as what I've searched or based on my readings, that in Japan though, there is a menu that in the menu, below in the menu, there is indicated there that if we going to eating a raw sashimi or sashimi, and that is murag nakabutan dito na murag about sa eating raw fish something. So that is why that those who are eating raw or improperly cooked fish will become infected with this such parasite. So that is why that it is very prevalent in the Japan, because it was indicated in the menu. And however, diphyllobothriasis was also nicknamed as a Jewish housewife's disease, as it was prevalent in Jewish households in America, as several dishes involve eating raw fish as part of the preparation process. But based on my readings, there is no supportive details about this. But based on my what I understand, that this is part of in the culture in the Jewish is to prepare, because mostly wives is the one who prepare for the meal or dish. So that is why it called the Jewish housewife's disease. So Tapeworm is often colloquially referred to as a pseudo tapeworm. Why it is called as a false tapeworm? Because false tapeworms because it is lack of its suckers or what we call the hooklets, but only it possess of botria or na siya two slit grooves. That is what we call the it turns into the botria. That botria will responsible for the attachment or siya ang nag-provide for attachments, but it is responsible for sucking actions. Unlike sa among cystodes of that belongs into the order Cyclophilidae, they have a in the head in scolex they have a four suckers or the hooklets, but instead this parasite has only two botria in the scolex or head. So next. So, is the finish. Thank you for